subject that's very, very important in our culture, and that's gastrointestinal issues. So why would a chiropractor be discussing GI issues? I can tell you why. It's because a huge amount of the patients that come into my office have these issues. It's a big part of my functional medicine practice, and what I'm finding is that I'm seeing younger and younger girls come in with worse and worse GI issues, and Carmen would attest to that, wouldn't you? Mm-hmm. As I was telling one of my female patients today, I see problems now that I never saw in practice when I first got into practice in 1981. I see younger and younger people getting sicker and sicker, and that's not the way it should be. And so I'm going to just throw some things out there and kind of engage you guys and see what you say. Why do you think that is? You know, why do you think that we're having more and more GI issues and more gastrointestinal problems that medicine, you know, modern medicine can't solve them, they can't even diagnose them very well. Why is that?
Because of all the preservatives that are put in foods?
Yeah, because our food supply has been pretty polluted, okay? Not only by preservatives, but if you look at pesticide residues and herbicide residues, that's certainly one thing. Yeah. What else?
Increased use of antibiotics.
Yeah, increased use of antibiotics, which does what, Dr. Adam?
It kills off a whole lot of those bacteria and allows some of the bad ones to take over.
Yeah, so you've got your gut flora, the bacteria in your gut, is one of the most important parts of the way your body functions. And they digest food, they produce natural antibiotics, they produce vitamins, and they're a very important part of your immune system. When you kill those off, that creates a whole host of GI issues. Now, a lot of the people I see, when they come in with GI issues, have anxiety. Now, what's the connection there? Anybody? What's the connection between your gut, what's going on in your gut, and anxiety?
Anxiety means you're worried over a lot of things, right? It just builds up.
Yeah.
And if you eat the wrong things that don't mix well.
Well, that's your
creating
sort
more
of
problems.
Here's the thing: you've got a gut-brain connection with a nerve called the vagus nerve.
Okay.
So what happens in your gut actually affects your brain. So when you have things going on in your GI tract that are not healthy, that are causing GI distress, that actually can affect your brain. It can cause depression, it can cause anxiety, it can cause mental illness, literal mental illness. It can cause a lot of things. And so the gut, I see a lot of people that when they have gut issues, they have brain issues along with that. Does that mean their brains are screwed up? No, it means that this gut-brain connection is working. The problem is the brain is picking up on the dysfunction in the GI tract, and that's creating the anxiety or depression or some of the other issues that are going on. So that is a definite issue. And so I'm seeing this more and more. I see it all the time. I like dealing with these issues. I'm pretty good at it, and I know how to diagnose it and treat it, but I'm just shocked at how much that I see. And so we want to dive in, take a little bit of a deep dive, and find out why these things happen. So, okay, turn it on. There we go. So common symptoms seen in functional GI distress. Now what I'm talking about, when I mean functional, well, let me ask you this. What am I talking about? When I say functional GI distress versus pathological GI distress, what is the difference between those two things?
sometimes the distress that you're feeling is meant to help adapt to a stress that's being put on the system.
Could be, yeah, absolutely. When I think of pathological stress, pathological symptoms, I'm thinking about like for example, stomach cancer would be pathological. Colon cancer would be pathological. Peptic ulcers could be pathological. Could be functional too. They start out functional, but they can turn into that. So anything that's really a pathology, if somebody comes into me with colon cancer, I'm not going to treat their colon cancer. That's a pathology. And while it started out as a functional problem, all pathologies start out as functional illnesses where there's just an imbalance. It's what's happened. It's gotten to the point now where it could be life and death. I'll send those people out, and we can treat the imbalances, but they'll need somebody else to help treat their if they've got cancer. But these are common symptoms I see in functional GI distress. Functional GI distress are problems that aren't readily or easily diagnosed through modern medicine, okay? So bloating, acid reflux, frequent or chronic abdominal pain, chronic diarrhea. You just wouldn't believe how many patients I see that have that, okay? And they come into me and they say, I've had it for years. Can you help me get rid of it? You know?
That's not healthy.
That's a long time.
That's a long time. Yeah, it's a long time.
Should have been taking care of that after a month.
Well, they tried.
Well, after
They've been
a
to,
week,
you know,
it's
they
pretty
go to,
sore.
they've been to gastroenterologists who've done colonoscopies, and the
Right.
colonoscopies come out normal. Okay? So they're not easily diagnosed by modern medical, the way the modern medical diagnosis systems. Constipation's another one. See that a lot. Or alternating diarrhea and constipation. Loss of appetite. I spelled that wrong, didn't I? Frequent belching and gas. Fatigue. These are the kinds of things I see. And you know, most of the patients that come in they don't have all of these, but they'll have like several of them. And it's not fun for them, you know? And you know, if you're a young woman and you have chronic diarrhea, that's not how you want your life, you know, that most young ladies didn't see that as how their life would go.
Right.
You know, so it's not normal. So functional medicine diagnostic procedures are really quite effective at finding the root causes of many GI issues. So people come in with the symptoms, but the symptoms aren't the problem. We have to look at what's really causing why are these women or why are these people having these symptoms? And sometimes it takes time to do that. It takes some real digging, some real testing. So if we look at what causes these problems, number one is inadequate production of pancreatic enzymes from chronic stress in the pancreas. So that's one thing that will cause it. I wonder what happened to number one. Okay, well. Chronic food intolerances, including wheat, gluten, dairy, soy, and peanuts, is another thing that causes a lot of these issues. The number one thing, I don't know what happened in my first slide on there, but loss of stomach acid, not enough stomach acid in the stomach to digest protein.
Is that where you get acid reflux if you don't have that
Yeah.
imbalance, right?
And what is the most common thing that's prescribed for low stomach acid? Anybody?
Zantac, Prilosec.
Yeah, proton pump inhibitors, which decrease the stomach acid further. Okay, so what causes low stomach acid? Anybody? Anybody know? I can tell
Lack
you.
of activity, exercise, lack of exercise.
I don't know if that would be so much. It might be.
It helps.
Number one is aging. As we
Yeah.
get older,
Yeah.
we don't produce it. Number two is overeating, chronic overeating. Number three is chronic eating of processed foods. Those are the things that cause low stomach acid. Okay? What do we do in our culture?
Go out to eat fast
TV
food.
dinners.
Chronic overeating
Yeah,
of processed
TV
food.
dinners, yeah.
We've all done it. Listen, I've done it. You
Yeah.
know, we've all done it. Okay. I try not to do it very often, that's for sure. Okay. Now, let's talk about SIBO, small intestinal bacterial overgrowth. It was originally thought to be a simple overgrowth or reflux of large intestine bacteria into the small intestine. Now, let me explain something to you. When you swallow food, it goes into your stomach, then it goes into your small intestine. The farther down the GI tract your food goes, the more concentrated the bacteria are. So bacteria, you have the greatest concentration of your bacterial flora is in your large intestine. Okay? So the farther down the food goes, the more bacteria. So what happened is it was thought to be a simple overgrowth or reflux of large intestine bacteria into the small intestine. In the small intestine, bacteria are responsible for absorption and synthesis of nutrients and protecting against pathogenic bacteria and yeast. So if you have chronic yeast infection, you probably have a dysfunction of bacteria in your small intestine, which would probably be coming from overuse of antibiotics. So when bacteria from the large intestine invade the small intestine, there's changes that can actually happen, physiologic changes. Number one is leaky gut. So the lining of your gut opens up and it starts leaking food into your blood before it's digested properly, which can create a whole host of problems in and of itself. That creates food allergies and sensitivities, nutrient deficiencies, inflammation, and impaired peristalsis. So what happens is that when you get this reflux, that can actually slow down the movement of your gut. And what is that? What's what happens then? What's a consequence of a slowing down of peristalsis, of moving your food through?
Constipation.
Constipation, that's right. That's why people are chronically constipated, or one of the reasons. So SIFO, small intestine fungal overgrowth, occurs when intestinal candida changes into its fungal form. So SIBO, if you take all the SIBO patients out there, 1/3 of them have pure SIBO, small intestinal bacterial overgrowth. 1/3 have a combination of SIBO and SIFO, and 1/3 are pure small intestinal fungal overgrowth. So how would I determine whether somebody had fungal overgrowth in their intestines? Anybody know?
Do a feces check.
You could do that. You could do it like that. You could do a comprehensive stool analysis, which I do that in my office. It's a very powerful test. But you can do a blood test and find out what their candida levels are, and if they have antibodies to that, that would probably tell you that right there. What are the most common SIBO symptoms? So you bloat within 30 to 60 minutes of a meal. Okay, you don't do it right away. You know, that food has to start getting down into your small intestine first. Bloating, it's worse by the end of the day. So you bloat and it just keeps getting worse and worse and worse and worse. You have an intolerance to fermented foods. So like you eat some sauerkraut or anything that's fermented, pickles. I mean, it makes it way worse. You can't take probiotics, prebiotics, garlic, and onions. It just makes you miserable. Chronic constipation or diarrhea. Classic SIBO symptoms. So what are the best tests for discovering whether you have SIBO or not? There's a breath test you can do which tests for hydrogen and methane. And you just blow in, and this is a thing where you blow into these tubes, 8 of them, and then you send them off, and it can tell you a fair amount. There's some advantages and disadvantages to the Cyrex lab test. Is a simple blood test. We'll test for the autoimmune portion of long-standing SIBO, and will indicate if there's permeability in the gut. So what this test does is it shows how long has a SIBO been there, and is it turning into an autoimmune disease? That can be pretty valuable information. Then you can use organic acid testing, which is a simple urine sample. This is really good for evaluating yeast and fungal overgrowth. I don't use this test a lot. It's a really good test. I haven't used it a lot in the office. But these are the main kinds of tests that I would use for looking at that. Now, most of my patients that come in here don't have SIBO. Some of them do, but most of them don't. Most of them have your simple, they have lack of stomach acid, lack of pancreatic enzymes. There's another, I don't know what happened to all my slides. There's another slide in here, is gallbladder dysfunction. That is another problem that I see all the time in practice, is people that their gallbladders either aren't working, or they still have a gallbladder, but their gallbladder, or it's been taken out. And here's the thing about gallbladder testing for gallbladders. It's probably one of the more, there isn't a very good test for that. In other words, there's no blood test for it. You can ultrasound it and see if there's stones in there, and that's helpful. But I found that for gallbladder, I have an in-office test that I do that works as well as anything. I can figure that out pretty well in the office. And then the best thing that I've known to do to give for gallbladder problems are bile salts. Okay, bile salts, because the gallbladder concentrates bile salts and uses that to digest fat. So when your gallbladder is not working properly, it's not digesting fat very well, and that's what gives you the symptoms of bloating and give you diarrhea, constipation. And one of our best-selling products is a product called Colacol, because so many people come in there and they don't have gallbladders, and that product is it's the only nutritional product I have that can almost take the place of an organ. I mean, it doesn't, but it's the only thing that comes close. So for SIBO, you want to avoid these foods, and I'll explain what these are in a minute. Anything that's fermented by bacteria in the large bowel, oligosaccharides, disaccharides, which are all milk and lactose products, monosaccharides, which is primarily fruit, and polyols. And you're going, what's a polyol? I'll show you in a minute. So there's this biphasic diet that can also be good for SIBO. And there's phase one, you reduce fermentable starches and fibers. You repair the damage to the gut with specific nutritional formulas. And then you eliminate harmful bacteria. And this is the SIBO protocol that I use. And part of this is what I use in my gut, or my stealth pathogen. So myrrh is a very powerful natural antibiotic. Gut flora complex really helps with the gut dysbiosis. And then you use a product called Vitanox and garlic forte. Garlic is a very, very powerful product for gut health. It really helps, for example, fungal overgrowth. Garlic is really, really good for that. So, and you can chew raw garlic and it'll do the same thing. Oops, how do we get there? Not sure why this is behaving like it is. Okay. So yeah, here is, okay, so in SIBO, the reason people get bloated is bacterial waste in the form of hydrogen, methane, and hydrogen sulfide gas causes small intestinal wall to be distended. So your body, and so here's a problem, is that it's too high to pass gas, too low to burp. So it takes about 24 hours for that to get out of there. If that's a symptom that you have where you bloat, and it takes about a day for it to go away, you probably have SIBO, and that's the reason why. Yeah, we've gone over this, gone over that.
That's where you were.
Yeah. That is not the end of my slide presentation. I don't know what's happening here. Okay. So, one of the things we want to do, I'm sorry about this. I don't know why this is doing this. These are other strategies that could be required in correcting GI distress. Is prokinetics to enhance intestinal motility. So one of the things that will do that is ginger. So making ginger tea will help move things through a little better. Biofilm busters, probiotics, and yeast and fungal support. ADP is oregano oil, grapefruit seed extract are all things that really, really work well with this. And so, you know, it takes, to correct these things, usually, here's what I do. I do an in-office evaluation where I look at the GI tract. I feel what's going on there. I look at specific points to see if there's a problem with low stomach acid or low pancreatic enzymes. And then, based on that, I can give the patient supplements even before I do some of the blood tests and testing for it. And so we can figure out, do they have a gallbladder problem? And sometimes people come in, they've had problems for years, and I do a GI evaluation and find that they've had a dysfunctional gallbladder, and you put them on things like Cholacol, bile salts, and they get way better, and they don't even need any blood tests. They don't need any testing beyond that. I've seen that, and that's great. On the other hand, people that have come in with chronic diarrhea for a long, long time, they're going to need some testing, especially if I don't find certain things in the office. So what are some of the things that you can think of that might cause that symptom? Anybody? Somebody comes in with chronic diarrhea. What do you think could be, what do you think are questions that I might ask that person?
What are you eating?
Okay, that's a good question. Yeah.
What are you eating? A lot of high grains, high dairy?
Yeah, so.
And anything that's peanuts or nuts, you know, of
So
some kind?
Yeah, so you ask them, one question is
Food allergies.
you know, are there any foods that are you pretty much eating anything you want?
Yeah.
If they say yes, that could be a clue, okay?
Yeah.
What else do you think I might ask them?
What medications are you on?
That's definitely a question I ask them, but there's even another one. So somebody comes in with chronic GI distress where they've had it for years and years. One of the questions I'll ask them is, have you ever been out of the country? Have you ever been to a third world country? You ever been to a country where you could have got infected by something, where the water wasn't good or the food wasn't good, because they might have a parasite?
Yeah.
And so, and I've seen that before. So you want to find that, those are things that you want to find out. And then based on their answers, then you can do the testing. So one of the things that I want to emphasize is that number one is there's a lot of people out there that have that. Number two is those people can really be helped. And number three, there's some very specific ways to go about that. And I would say this, you know, you guys may know people that have chronic GI issues that are not getting help. You know, you can't, a colonoscopy will almost always not figure that out unless there's some sort of pathology going on. And colonoscopies are essentially 99% negative. So what would you do? What do you do with the patient as a colonoscopy and they still have the problem? You know, the fact is the GI doctors don't know what to do. They don't know what to do with them. So I would say this, if you know people like that, send them in here. At least have them talk to me. There is hope for those people. They don't have to live like that. And I would say this, if you know somebody, have them call my office. I'll talk to them on the phone if I need to. But they don't have to live like that. There are ways to correct those issues and to really help them and to help them without a lot of the pharmaceuticals and surgical procedures that are sometimes offered to them. So that's all I have for tonight. Anybody have any questions about anything I've gone over? Yeah, Dr. Adam.
With the Cyrex test, I think you talked about finding out how long a SIBO infection had been around, that it was possible to test as well with that for a leaky gut. Is that one of the tests you might use for leaky gut in general, even if there was no SIBO indicated?
You could. I generally don't use a Cyrex test for that one. I use another test called the Wheat-Zoomer test, which has a very good leaky gut test, but it also tests for all the aspects of wheat and gluten sensitivity. So I want to know how sensitive this person is to wheat and gluten. This will test for all of that. And so, and plus it gives a very good leaky gut test. So I probably wouldn't use a Cyrex test for that one, for that reason, because I can get really good information off that test. And it's about the same price as a Cyrex test. So, yeah, Terry.
Opiums, you know, a lot of opium use, like cocaine is being used nowadays. That slows down the GI tract. Can that be helpful in using it with like
No.
SIBO?
It's never helpful for that.
Never, okay.
No. You don't want to slow the GI tract down. You want to find the cause.
Okay.
You want the GI tract to work normally, but you want to find out why it's not. And those painkillers, what painkillers do is they dumb down the GI tract because the GI tract has its own nervous system that functions literally, can even function apart from the brain.
Yeah.
And so when you take those painkillers, that dumbs down the nervous system of the GI tract, and it actually causes constipation. So I don't recommend that for anybody. No, you don't want it. You don't want that. You want to correct what's really going on. Good. Well, I think I finished a minute early. Okay. So thank you all for coming tonight and for taking a half hour out to learn about a problem that is just rampant in our culture. And in let's see, what's our next
2 weeks.
2 weeks from now, which would be we're gonna talk about the nervous system in health and disease. It's a core chiropractic class. So if you're a chiropractic patient, you've never seen that talk, that is one that you need to see. Great. Okay, thank you so much for being here. Thanks, Timmer, for